Hi, my name is Patrick and I'm a Pulmonary and Critical Care Fellow. This video is on O2 pulse. This is the 9-panel plot, of which we'll be focusing on panels 2 and panels 3. This is our modified Fick equation that we use for VO2, and if we divide both sides by heart rate, we're left with this equation. And we can use this equation as a surrogate for stroke volume, assuming that O2 extraction is constant and there is no desaturation. So this becomes the O2 pulse and how we infer the patient's stroke volume, one of the most important measures that we have during CPET. A quick reminder on the 4 phases of the CPET test and the 3 vertical lines that separate them, and you'll see each of these lines on each of the 9-panel plots. Now let's look at panel 2 of the 9-panel plot. Here we're looking at heart rate and O2 pulse. So immediately at the start of exercise from rest, we have withdrawal of our parasympathetic tone, and then later we have progressive sympathetic stimulation causing further increases. If you compare the trajectories of both of these variables, heart rate and O2 pulse, while they're both climbing simultaneously, the O2 pulse, i.e. the stroke volume, usually increases more rapidly. And this panel is useful for identifying abnormal variations in heart rate pattern from, for example, ischemic heart disease, medications, autonomic dysfunction, or just pre-test anticipation. And a peak heart rate near the predicted maximal value is useful in supporting the impression of adequate effort, but it can be reduced. Heart rate can be reduced by medications or intrinsic chronotropic impairment, so a peak heart rate less than predicted does not necessarily indicate poor effort. So staying with panel 2, in conditions where we have a lower than expected maximal O2 pulse, it could be one from a low exercise stroke volume. For example, they have LV failure, like you could see in the top right panel there, or they have ischemia, like in the bottom right panel where they have a plateau. It could be because they have a reduced arterial oxygen content, and less commonly, it can be due to either they have a circulatory defect to a muscle, or they actually have a defect in the muscle's oxidative capacity. And so when the O2 pulse does not clearly reach a plateau, a low peak value could simply just reflect a premature ending of the test because of pain or symptoms or motivation, and not a true attainment of maximal VO2. And then higher than average values for O2 pulse indicate a high exercise stroke volume. And this is typically a characteristic of endurance-trained athletes who have left ventricular hypertrophy and have increased their stroke volume. But it is something that can also occur in non-athletes from impairment of their heart rate by medication or disease, such as chronotropic incompetence, where because the heart rate can increase, the stroke volume is left to compensate. Now we're going to look at panel 3, focusing on heart rate to VO2. You can ignore the black circles, which are looking at VCO2 to VO2. That is known as the V-slope method for determining the anaerobic threshold. The red X, which you can see here, indicates the predicted maximal heart rate, and so based on the trajectory towards it, you can see where they fall. Normally, the change in heart rate relative to VO2 is quite linear over the test. Changes can happen with endurance training or deconditioning. For example, someone who's undergone endurance training tends to have a shallower slope compared to those who are less fit. And this is because they're able to increase their VO2 without having to increase their heart rate that much. Whereas if you're deconditioned, you primarily increase your VO2 by increasing your heart rate quite aggressively. And this is one of the ways that we can look to see if this is a generalized impairment in heart rate response or a submaximal effort. So to go over that again, here we have someone who is relatively deconditioned compared to normal because you can see they're above the predicted maximal heart rate trajectory. And here is someone who is below, who has a shallower line, who is more conditioned, who is more fit.